So my name's Damian. I'm 46 years old. I got diagnosed with MS about 12 years ago. I've got the classic sort of MS, so everyday life is pretty affected. I've got trouble walking the dog, lifting, getting around the house, that sort of thing. When you get MS, you get handed down, here's what you need to do, and it's it's the thing that you need to do of 30 years ago that they used to tell people to do, and it's not as progressive as what's actually out there and available today. So that's probably why we spent a bit of time looking around and researching into it. I think that really working with somebody that understands the disease and what things are causing what and how you could improve those things help a lot. And I guess Charlie and I got talking, and we talked for a while over a period of time, and that's kind of how I ended up where we are today. I've definitely found working with Charlie very beneficial. It's a fairly open day in, day out kind of catch up that we have and work together, and working out, I think, together is important rather than being told directly from somebody what you need to do. It's a bit of a two-way street really to work towards making improvements, and I feel that Charlie really understands that. So certainly there's improvements since working with Charlie in my foot drop, yep, and out of the community I'm walking more, so a longer distance each day, and probably the biggest thing is my torso kind of swinging. When you have MS, you turn into a refrigerator, and you move like a refrigerator, whereas the body actually needs, your upper body needs to flex as you move in the opposite direction to when you're walking. So my improvement in the upper body movement, which makes walking so much easier, has been drastic. I was walking about 500 meters a day previously, and now I'm walking up to 1.5 kilometers a day. I've certainly noticed I'm much more confident around the place, and in the gym environment in here, around the machines, and I'm much more confident in using them and the way I sort of portray myself or move about than when I initially started. Confidence plays a huge part. If you're not confident when doing something, then your body just slowly closes and closes and closes up. And with that, obviously walking and things become much more difficult as your body's system closes down a bit. So I used to be quite fearful in getting around, in terms of worried about falling over. Certainly when I used to arrive here at the gym, I would park as close as I could to the gym so I didn't have to walk very far, and what I've noticed, I will now park further from the clinic and walk to the clinic without being in fear of falling over. I'm somebody that's pretty versed in MS and like the things that you do to improve. Some of the exercises I've been doing here with Charlie I've never seen before, and the improvements from them have been huge. Using the medicine ball, I certainly 4 or 5 months ago I would have never considered bouncing a ball, and now I will do it with confidence without fear of falling over at the drop of a hat. And I think we do it in almost every session now. When we started, a lot of it was about strength, and then it moved to more functional type stuff. So we've got to the point lately in terms of my progression where we're doing more high intensity type stuff, and by the end of the session I feel like I've had a real workout. So if you're a person with MS and you're considering working with Charlie, I would certainly recommend it based on the improvements that I've had since we've been working together.